Okay, I think we'll go ahead and make a start. Some people are still coming in after lunch. I want to welcome everybody to the 2021 Water and Health Conference, and thank you again for everybody joining our session straight after lunch, hopefully. My name is Warner Passanisi. I'm representing the Water Institute here at UNC, and I'm your room host today in this session. Before we get started, we've just got a few announcements to make, if you don't mind. We're encouraging everybody to go to the networking on Remo later this afternoon, 3:30. Details are in your registration on the website. Next slide, please. We're also encouraging people to come to the late early show, which has been really interesting. I don't know if you guys have caught that before, but it's a way of catching up on what's happened before. We've got Dr. Regina Salter and Alexander Winkeska, who will be looking at the day's events from a perspective of Southeast Asia and Pacific, in this case. Next slide. Also encouraging people this afternoon to go, I think, oh yeah, going to the really interesting session on careers in WASH for young professionals, which we're encouraging many people to attend. That's later this afternoon. And then we are reminding people that the chat feature in Zoom here is disabled, and we want to channel all chat comments, discussion items, things you want to share, please in the Pathable chat link that you use to log into this site. Next slide, please. We want to thank our sponsors for this session, Clean Water Here, the Latter-day Saints Charities, P&G, for making this session work. Thank you. Next slide, please. We're going to be going, yeah, we got slightly different presenters here. We're going to be doing some presentations in alphabetical order. I want to let you know that this session is being recorded, including everything in the chat feature in Pathable. This is live. Everybody except the presenters are going to be muted. We also encourage people, if you need to, you can raise your hand in the Zoom chat box at the bottom under reactions. All of the materials that are being presented are available in the files section in Pathable as well. And again, even after a presenter's session, encourage you can chat with them there. Okay, let's move ahead. Our first presenter, and we've got approximately 10 minutes for a presentation, 5 minutes Q&A afterwards as well, to encourage a nice flow. Our first presenter is Nagin Ahadzadi, forgive me, I hope I pronounced that right, from Toronto, a student, and another wonderful aspect of we're dealing with students, the cutting edge of research and science right now in the COVID era. So Nagin, welcome, and the floor is yours.
Thank you. So can you see my presentation? Okay, hello everyone. Today I will talk about improving equity in intermittent water supplies through design practices and operational strategy. So what is an intermittent water supply? Having a pipe underground and even having enough water resources cannot guarantee that we can deliver adequate water to the households. About 1 billion people around the world are getting their water from intermittent water supplies. This intermittency could be because of water scarcity, obviously, but it could be also because of poor infrastructures and management, poor water governance, and water use behavior. Inequity is one of the several problems with intermittent water supplies. For example, in Delhi, some households have access to tap water 24/7, but in some other part of the city, this access duration is less than 1 hour every 3 days. This inequity is not limited to the supply duration and frequency. The amount of the water and the quality of the water which is distributed in these networks are not the same throughout the network as well. Here our focus is on understanding equity in terms of the delivered volume of the water. Water pipes are pressurized pipe, which means that water moves throughout the pipes because of pressure difference in the system. So we use a reservoir at high point of the system, or we pump the water to supply a network. In a continuous system, when we have enough water and pressure, all the consumers can get their demand from the system, no matter where they are located. But when we supply the system for a short period of time with low pressure, which is the case in intermittent supplies, the amount of the water is not the same all over the network. People try to get as much water as they can, and this amount is dependent on the available pressure at their location. Based on the conservation of energy, pressure in a network drops because of friction and increase in elevation. This means that high points of the system and points far from the reservoir experience a lower pressure, and the consumers at those locations can get less water. Here we presented a simple model of an intermittent supply, which consists of a simple reservoir pipe system, and we assume that the consumers are located and distributed along the pipe, and they leave their taps open to get as much water as they can. The physical representation of this assumption is a longitudinal slot at the top of the pipe, which acts as an uncontrolled orifice and allows us to calculate the amount of the delivered water at each point of the pipe. In the next step, we need a definition for equity and metric to evaluate our model. We define equity as having the minimum relative difference in the delivered water. And based on this definition, when we have a horizontal pipe, we define the volumetric equity as the ratio of the minimum to the maximum delivered water. And when we have undulating pipe profile and local minimum delivered water at those points, we use the Gini coefficient inequality, which is originally a measure of income inequality distribution in a population. And then the maximum equity is achieved when the volumetric equity is 1 and the Gini coefficient is 0. We used our model and our metrics to answer a few questions around equity in these networks. What's the effect of pipe size on equity? Is it better to supply a system with a higher pressure, or it's better to supply with a lower pressure? Where we should put the reservoir? How should we plan our leakage management practices? And what is the effect of pumping groundwater into the system? To find the dimension of the pipe and demand for our analysis, we assumed a residential pipe at the level of a minor street in Delhi, and we assumed that this pipe is supplied 3 hours a day. First question was about the pipe diameter. We calculated the volumetric equity for our residential pipe with different diameters. Here you can see that by increasing the pipe diameter, the volumetric equity increases. Next question was about the supply pressure. So we know that in the real world, pipes are not horizontal, and we have elevation difference in the system. To reflect this in our model, we assume that we have a peak or a trough point at the middle of the pipe, and it has different slopes. Then we calculated the Gini coefficient of these pipes under different supply pressures. If we plot these Gini coefficients versus the ratio of the supply pressure to the maximum elevation difference in the system, we reach to this graphs, and then you can see that pipes with troughs have a lower inequality and Gini coefficient, but pipes with peak points have a higher inequality. Also, they need higher pressure to reduce these inequalities. The next question is about reservoir location. Should we put the reservoir near high density areas, or we should put there near the area that we have higher demand per capita? To answer this question, we divided our pipe into two halves, and then we changed the demand per capita and density in each half. When we have a uniform population and demand along the pipe, the Gini coefficient is 6%. But when we have a higher demand near the reservoir, this Gini coefficient increases to 26%. But if we move the reservoir and put it far from this high demand, the Gini coefficient would reduce to 9%. Also, if this extra demand serves more people, which means that we have a higher density near the reservoir, the Gini coefficient would be 10%. What we can learn from the previous slide is that usually when we design water distribution networks, we choose the reservoir location based on the water resource location, also the topography of the system. But if we want to consider the volumetric equity as an additional criterion, we should put the reservoir near high density areas and far from the people who have higher demand per capita. Also, we can learn another lesson from that graph. So we know that water pipes become leaky gradually, and if we and they need maintenance and leakage reduction. So if we assume this extra leakage as an extra demand, which is added to the system, we saw that when the reservoir is far from the extra demand, the system is more equitable, which means that to have a higher equity, we should prioritize pipes near the reservoir for maintenance and leakage reduction. And the last question was about the utility operated pumps, which pump groundwater into the system to improve the system. To see this effect, the effect of these pumps, we put a well and a pump at the downstream of our simple model. And then we saw that it improved equity by 24 percentage points. However, we should consider that pumping untreated groundwater into the system may cause inequity in the quality of the distributed water. So we should consider a trade-off between quality and quantity here. And finally, to recap our suggestions to improve equity, I should say that it's better to choose pipes with the larger diameters in the design stage. Also, it's better to supply the system with a higher pressure, and this high pressure depends on the maximum elevation difference in the system. And it's better to put the reservoir near high density areas and put it far from the consumers who have higher demand per capita. And we should prioritize pipes near the reservoir and the supply of the system for maintenance and leakage reduction. And finally, using utility operated pumps and basically supplying the system from different points can improve equity. Thank you. That's it.
Lovely. Thank you, Negin. Appreciate that very clear, timely presentation. Again, I encourage participants, if you have any questions and comments, please use the Pathable chat box. And you can also raise your hand here at the bottom under reactions. Please raise your hand if you have any questions. So please, we open it up for Q&A with Negin. I see Gokul already is, please ask your question.
Hi, Negin. It was a great presentation. I really enjoyed it, and it's of a lot of interest to me and my own research interests. I have a question about supply pressure and leakage reduction, which I think all water utilities know are key to resolving this intermittent water supply and great inequality. What are the ways we can actually increase pressure and reduce leakage? And do you think this has anything to do with urban planning?
Yes, that's a great question, because usually we reduce the supply pressure to reduce the leakage, because we know that leakage is a function of the pressure. There is another part of our research. I didn't talk about that, but we saw that when we have a flat system, a flat area in the system, the pressure is not the only factor. And if we want to reduce the pressure, we can maintain the same equity, but we should increase the duration of the supply. So what I think is that if we so we know that in a water distribution network, we have different zones with different elevation change. So I think based on what we see in our model, we should see that the flat pipe part of the system, we can reduce the pressure at that point. But when we have a hilly parts in the system, we need higher pressure. So it seems that we should prioritize those parts of the system for improving the leakage and changing the pipes more frequently, but supply that points with a higher pressure.
Lovely. Thank you, Gokul. Again, what about sort of utilization in real world settings and plans for future work? Can you talk a little bit about that?
So our model is a simple model with just one pipe, but our research has another part. We calibrate our model for a real network. So we try to model a whole network with different loops and pipes, and even different demand throughout the system as one pipe. And we see the same trend in the result in that one. So we can say, obviously it is more evaluation, but we can say that we can scale these results in a real world.
Thank you. Any thoughts on sort of cost benefit analysis on suggestions for where to put interventions in?
So the point is that, so we here suggested to use bigger pipes, higher pressure. So these need more cost, but when it comes to equity, I think we should cost more to make the system more equitable. Yes.
Lovely. Thank you. Any further questions? I encourage anybody with other questions or follow-up. Oh, we have Sajal, please. Sajal, will you ask your question?
Hello.
Hi.
Am I audible? Hi. So I just wanted to know whether we can account illegal connections that are very frequent in areas where there are, in generally low-income countries, into this research, and how illegal connections definitely affect your supply pressure as well as the leakage that happens in pipes. So I was just wondering whether those can be accounted into the research.
Yes, that's a real great question. So I would say that, so we know that in these networks, we have a lot of crazy pipes that are connected illegally to the network. And because of that, it's really hard to model these networks with a complex and very accurate modeling. Because of that, we think of having a very simplified model which doesn't include any structural details, and to have get some general understanding of this inequality. So because we knew that those illegal connections do not let us to have a very accurate modeling, so we take this approach to have a simplified but to understand the basic trends in these networks.
Thank you. Thank you.
Thank you very much. Nagin, thank you so much for your presentation. Again, any further comments or questions, please use the Pathable link. Nagin, thank you. We're going to move ahead to our second of three presenters. Emily Floss, a PhD student from North Carolina State University. Emily, you have the floor.
I think everyone can see my screen. Hi, everyone. My name is Emily Floss from North Carolina State University, and I am presenting on the health impacts of boiling drinking water with solid fuels, and this is a modeling study. Unsafe water and indoor air pollution are two of the biggest environmental health risks. This map shows the premature deaths from unsafe water, sanitation, and hygiene. Globally, approximately 1 billion people lack access to safe drinking water supplies, resulting in approximately 1.7 million deaths annually. This map on the right shows the global indoor air pollution premature deaths. Globally, approximately 2.8 billion people cook using solid fuels, resulting in 2.6 million deaths annually. Boiling is the most common household water treatment method, with an estimated 1.2 billion users, or 70% of all household water treatment users. However, boiling often takes place with solid fuels. So the objective of the study are to model the health trade-offs from boiling drinking water with solid fuels. We use existing models for calculating disability-adjusted life years, or DALYs, for both water and air. We use a Monte Carlo analysis to understand uncertainty and variability, and we focus on two countries with a high prevalence of boiling, Uganda and Vietnam. So we synthesize existing models to compare health trade-offs, and the goal is to calculate the total DALYs for a family from both water and air. So for drinking water, we do a quantitative microbial risk assessment for 3 major pathogens, Campylobacter, rotavirus, and Cryptosporidium, to calculate DALYs. We do this using different boiling scenarios, and we estimate a family's exposure to pathogens from their drinking water. For the indoor air pollution, we use a box model integrated exposure response function to estimate the 24-hour PM2.5 concentration and corresponding DALYs. We do this for different traditional, improved, and modern stoves. And we estimate a family's exposure to PM2.5 from cooking and water boiling. And the goal is to compare the exposure to pathogens and exposure to PM2.5 and how they balance with boiling water. So these are our model inputs. I want to note that all the inputs are distributions taken from literature. So for drinking water DALYs, we have a volume of drinking water. We have a source water quality with 3 scenarios, and we have a boiling effectiveness with 7 scenarios. And these are used to calculate the dose of pathogen. And then we vary the country demographics. So we have the different age distribution of the population for our 2 countries. And then we have dose response parameters, and we calculate a decrease in drinking water DALYs from diarrhea from boiling water. For indoor air pollution, we have household energy needs, and we have 3 scenarios. We have kitchen characteristics, and we have cook stove characteristics, which we have 6 scenarios for. And we calculate the 24-hour PM2.5 concentration. We combine this with exposure to concentration ratios to calculate the relative risk. And then we have a country level disease burden of calculated from percent solid fuel users in our given countries and country level DALYs by demographic group. And finally, we calculate the increase in indoor air pollution DALYs from boiling water. And for our boiling effectiveness, I will talk more about that on the next slide. And for relative risk, I will talk more on the next future slide. So for the boiling effectiveness, we use literature-based log removal values of indicator bacteria. So I did a literature review of all the studies that talked about field studies of the log removal value. And we used E. coli to fecal coliform and E. coli to thermotonic coliform ratios to convert all to E. coli. And this shows the log reduction value, which is the log of the influent pathogen over the effluent pathogen. And we use a range of values in the model shown here, ranging from very effective boiling, such as seen in the lab, all the way to ineffective, where the post-boiling water quality is worse than the source due to post-boiling contamination. And I use these in my model. And so this shows the DALYs reduction from boiling water, and I'm showing results from Uganda, and we have our different log reduction values taken from the literature values, and we have our 3 water risk levels. And you can see that in some scenarios, water is more contaminated than source water after boiling. But good boiling can significantly decrease DALYs even in low risk water. and moderately effective boiling significantly reduces dollies. So you can see effective boiling has a very large reduction in dollies. For the dollies from PM 2.5, we calculate the following risks from PM 2.5: lung cancer, ischemic heart disease, stroke, chronic obstructive pulmonary disease, and acute lower respiratory infection. And from the relative risk, we calculate the disease burden. And this plot shows the relative risk versus PM 2.5 exposure for the acute lower respiratory infection. And if you notice the shape of the curve, if someone's exposed to lower levels of PM 2.5, if their exposure increases, there's a very rapid increase in the risk. But if they're exposed to very high levels of PM, their risk is very high, and additional levels of exposure don't increase the risk very much because it's already so high. And this is known as the log linear shape of the relative risk curve. And this will be important for our results in different stove use scenarios. So this plot shows that stove matters, but incremental dollies from boiling are small. And once again, these are results from Uganda, and I highlight the impact on children under 5 with the lighter shade. And we have 3 scenarios of stove use. One is where a household is cooking only. One is where a household's water heating only on their stove, and one, they're using the same stove for both water heating and cooking. And we have our different stove types ranging from very clean electric to serve in the middle, such as gasifier and charcoal stoves, to traditional wood stoves. You can see that if a family replaced traditional stoves with clean stoves, this significantly reduces the dollies. But once the PM 2.5 exposure reaches a high level, such as from using a traditional wood stove, the additional dollies from boiling are small. So if they're exposed to the smoke from cooking, if they start water boiling on the stove, it won't increase their risk from indoor air pollution very much. So this plot shows the air impacts compared to the water impacts, and we find that the air impacts are outweighed by water benefits. And once again, these are the results for Uganda, and I highlight the impact on children under 5 with the lighter shade. And we have our different boiling effectiveness and stove types. And this shows the net change in dollies from boiling. And we have our 3 water risk levels. And then we have our scenarios of boiling and cooking on the same stove and boiling only. And you can see that on this side, the benefit of boiling water or the dollies reduction. And we have it in order of worsening source water quality. And this shows the negative impact of boiling water or the dollies increase. And we have the stoves in order of increasing PM 2.5. And you can see that in a scenario where our household is already cooking and then they start boiling the water, the net difference in risk is very small. But if a household was not cooking at all and they start boiling on a wood stove, the additional risk will be very high. And so you can see that in cases where a household was already cooking and they start boiling, in all cases, but except for ineffective boiling, the benefits of boiling outweigh the risks of the indoor air pollution. But if a household was not cooking on a wood stove and they want to start boiling, they should make sure to use very effective boiling, and the benefits are most for medium and high risk water. I wanted to show the impact on different demographics. So this plot is this similar plot as before, but we use the values for Vietnam, and all the value inputs were the same except for the country demographics, the percent solid fuel use, and the burden of disease by age group. And you can see that for a given population using the same source water and cook stove type, changing the country demographic changes the fraction of the burden impacting children under 5. So, and you can see that the lighter shade of under 5 years is smaller for Vietnam simply because they have a much older population. So these are the conclusions from our modeling study. First, boiling drinking water reduced the diarrhea disease burden, but had minimal impacts for drinking water with low levels of contamination and ineffective boiling. Second, there are significant reductions in dollies from switching to cleaner stoves, but minimal changes from boiling and cooking versus only cooking. Third, boiling water in addition to cooking on the same stove was associated with limited increased risk from indoor air pollution. And finally, boiling had a net reduction in total dollies for medium and high risk water, even if using unclean cook stoves. Thank you.
Thank you, Emily. Really appreciate that. Again, all questions, comments in Pathable, or just raise your hand as we did before. Fantastic. That's really interesting, Emily. I take it this is part of your PhD research, death-bound modeling in COVID times. If you had your time again, and or you get funding to continue this post COVID restrictions, where would you take this study, do you think?
Yeah, I guess I would be really curious to know first, like, I guess how much the fraction of energy people are really using for boiling water, because I did like a very like mathematical estimate, like this is how much people drink, like let's assume they heat all their water, but I'd be really curious to know, like, if a household's boiling, are they like fully boiling it, like how much fuel are they using, to what temperature are they reaching to? But focusing sort of on the air pollution and the fuel side.
Interesting. And your choice of countries, can you just go over that again? And if so, what you might use in comparative studies? And would you use an sort of urban-rural divide as well?
Yeah, that's a good question. So I thought about a few different countries. I ended up picking Uganda and Vietnam for these models because both of them have a pretty high percentage of water boiling, but neither heat, because I wanted to incorporate heating, but I did not incorporate that in my model because that adds a whole nother factor, because sometimes if a household's heating, they sometimes use the same like stove for boiling water. So I think it'll be really interesting to look at heating, but I didn't want to complicate it. So I forget the second part of your question, but that was.
I'm wondering which other countries, either for the data that's already available, so you can do a bit more comparative there, or in the field for some pilot studies on some ideas, hypotheses that have been generated by this.
Yeah, I think if I'd take a next step, I'd really want to look at heating, because I think the same hypothesis would be there. If a household's already heating and then they start boiling, the additional risk would be very small. So I think looking at some countries, I think looking at China in the field or as a model would be very interesting, because there's a lot of heating and there's also a lot of water boiling. So I think that would be an interesting next step.
Excellent. How much longer have you got in your studies, if you don't mind me asking?
I think 2 or 3 years, more years. I'm not sure. This is my third year.
Well, let's hope you get some breadth to do the sort of research you really want to. Any other questions, please? Is there a lot of data out there that you have not been able to incorporate into this study?
I've tried to like get as much detail as I could. I guess without making the model extremely complicated. I think one thing I was surprised that there wasn't that great data on is the breakdown of how a household uses energy. So like what fraction of their energy goes towards cooking, what fraction goes towards water heating. And I know these like values are very difficult to collect in the field because you have to estimate like how much fuel they're using. But I pretty much just use like a generic value for all people, like all people consume this amount of energy for cooking every day. And I think that was a very rough estimate, but I actually struggled to find a lot of good values in the literature. So.
That's interesting. I would hope there is some data out there on those issues. Emily, thank you. We've come to the end of our time there. Thank you so much for that. Again, for others, if you have questions, comments, please feel free to contact us in the Pathwell chat box or contact Emily directly. Again, Emily, thank you very much. Okay, we're coming to our third and final presenter. This is Gokul Sampath, another PhD student from Boston, from MIT. Gokul, I hand the floor over to you.
Great, thank you, Warner. So my name is Gokul Sampath. I'm a doctoral student in urban studies and planning at the Massachusetts Institute of Technology. And I'm here to present to you an ongoing project entitled The Friction of Distance: Decision-Making Factors Governing Arsenic Safe Water Source Selection in India. And I worked on this project with Professor Catherine Alfredo, who is a professor of environmental engineering at the University of South Florida. So naturally occurring arsenic in groundwater is a major public health hazard in the state of West Bengal, India. 80% of households are reliant on untreated well water. 6 districts are classified as highly affected, and it's estimated that over 6 million people are exposed in the state of West Bengal alone. Now, broadly, there are 2 camps in the arsenic mitigation literature. One is the soft infrastructure camp, which focuses on the design of filters to remove arsenic from drinking water. And the second is the public health camp, which focuses on behavior change approaches to get households to switch from tainted sources to safe ones. Now, public health scholars have found that information can drive households to switch to safer sources, but the mechanism by which information operates is more unclear. There are definitely many factors that drive households to adopt safe sources, but we think that the friction of distance, or the time and effort barriers, or time and effort to overcome distance barriers, must play a key role. This is especially true and salient in the context of rural West Bengal, where safe sources are often distant community ones, and unsafe sources are usually on the home premises. Now, the factors governing arsenic safe source adoption are many. These include household demographics, chemistry, perception, and the characteristics of the primary water collectors. The main takeaway here is that a number of studies have examined direct relationships, but fewer have examined the way factors interact to drive safe source adoption. One piece of this puzzle is household demographics. These are important variables to control for in any effort to model safe source adoption. As Mosler noted in his 2010 paper, data revealed that social factors explain greater variance in the consumption of safe sources than did situational and personal ones. Also of importance is perceptions, which have received substantial attention from public health scholars. However, we feel that perhaps these relationships are more murky, where chemistry drives psychological factors, and perhaps we should turn to more direct, potentially direct effects like the friction of distance. So the relationship that we are interested in here is the interaction between distance, information, and the way these two things are further modified by levels of free time. We ask whether this information is strong enough to modify the relationship between difference and safe source adoption, and whether free time plays a role. The relationship we're interested in is at the intersection of these three things. This motivates our research questions. Does information modify the association between distance and the probability of arsenic safe source adoption? Does information modify the association between distance and the quantity of arsenic safe water in liters consumed by households who are not total safe source adopters? And three, if information does modify the association between distance and adoption/consumption, is the modification different if the primary water collector has free time to travel further to a safe source? Now, this second question assumes a two-part decision model, that the adoption and consumption functions are separate, and we'll explain more of this later. And the third question here tests for the presence of a triple interaction, the interaction between distance, information, and free time. So the area we chose to focus on for this study was Nadia district in the state of West Bengal, India. And our population was rural households in highly arsenic affected districts of the state, and Nadia is among these, which is a predominantly rural arsenic affected district. So our sample villages were representative of the population of rural arsenic affected villages in the state in key ways, but in some ways they sort of deviated. Here we see Nadia district and the Chagda development block where our study was undertaken, our 5 study villages, and our sample size of 116 households. Now, this is a relatively small sample size, but we feel it was sufficient. We found that the sample was representative of the population on more fixed characteristics used by the Indian census to measure socioeconomic status, like quality of housing and female literacy. But not surprisingly, Indian ownership of durable goods in India has changed substantially between 2011 and 2017 due to secular trends. So we feel like even though these asset indicator variables are different between our sample and the population, in key ways, this sample is representative. So what makes our study unique and different? Well, a lot of this has to do with our data. We calculated actual household water consumption through measurement by giving households water containers of specified size and charts to record their water usage over time, segregated by use task. We also measured distances between households and various sources, including safe sources, directly by walking with primary water collectors along their routes from households to safe sources. So the takeaway here is that while our sample size is small, 116 households, Despite having few observations, our data is accurate, rich, and internally valid. What we purport to be measuring in terms of water consumption is what we are actually measuring. Our data sources were data on arsenic levels in water, water consumption measurements, route distances to sources, and a demographic and water attitude survey. And we input this data into two models, an arsenic exposure model to estimate the risk to households based off of perceived versus actual measurements of water consumption, and a two-part decision-making model, modeling the adoption decision using a linear probability model, and the consumption function using fixed effects OLS for a continuous outcome, safe consumption leaders. So what we found is that on average, study participants' safe source compliance was substantially different based on usage tasks, cooking versus drinking. Safe source compliance was far greater for drinking water than for cooking water. This could be because of the just-in-time nature of cooking tasks when households need water right away to make something, and therefore they may not be willing to walk farther to a distant community source that's safer. The takeaway here is that health information campaigns on the danger of arsenic in water should focus on both cooking and drinking. So looking at exposure, we find that the log estimated exposure risk is higher when we calculate measurements directly versus using theoretical approaches used in other studies often, considering drinking water alone. Failure to account for both cooking and drinking consumption and measuring water through just survey responses from households might severely underestimate exposure risk. So what is this two-part decision-making model that I've been going on about? Well, this was motivated by when we started looking at the data more closely, we noticed a pattern. So about half the sample showed the expected negative relationship between distance and safe cooking consumption, but the other half seemed to be committed to the safe source irrespective of how far away they lived from it. And this got us thinking, perhaps the decision to adopt the safe source or not was separate from the decision of how much to consume versus distance. We started thinking that this is maybe a little bit like, cigarette public health models to model smoking, where the decision whether or not to be a smoker was separate than how many cigarettes you consume based off of price. So we computed our model like this, and this is a lot of Greek. The key takeaways here is that we're interested in the triple interaction term, information, distance, and old. And old was our proxy for whether a primary water collector had free time. We assumed that grandmas had more free time than busy moms. And we controlled for a number of socio-demographic factors and village fixed effects. So our first research question was, does information modify the effective distance on the probability of arsenic safe source adoption? And we fit a model taxonomy with the number of controls. We're going to focus on models 5 and 6, our final models. So what we found is a significant triple interaction that the information modified distance, but only when primary water collectors had free time. But what was strange is our model behaved weirdly in that we got a large main effect for the interaction between information and free time. So this could be for a number of reasons. At some level, triple interaction models always have quite a bit of multicollinearity going on because you're computing predictors from other predictors in the model. But at the same time, we're not sure how to interpret this for model 1 because only 11% of our sample was over 50 and about 29% were informed. And there were few cases of both, and they often predicted adoption. So as probabilities get closer to 0 and 1, King and Zhang tell us that they often can suffer from rare events bias. We chose to use a linear probability model here rather than logistic regression. So we're hoping we can trust these results because LPM has been shown to outperform logistic models when looking at rare events. For the second part of the function consumption, we found, again, a significant triple interaction here between information, distance, and our proxy for free time. Our model automatically omitted this main effect that was highly collinear between information and age. And we feel comfortable with this so far because triple interaction models are known to have collinearity. Our outcome here is continuous, and rare events bias should not be an issue here because we're not making 0-1 predictions. So what this looks like when we put it on a graph is that for households which are over 50 years old, you see the relationship between distance to safe source is positive when households are informed, and is negative when they're under 50 years old, so less free time. And we think that this shows that information and free time can overcome the friction of distance. So the takeaway here is that distance barriers might be able to be overcome by information, but only in cases where the primary water collector has the free time to act on that information. So what does this mean for policy decisions and future work? So we feel that future studies and public health interventions should consider arsenic unsafe water consumption as a whole, not just asking households about drinking water. That the decision to adopt as a safe source may be separate from the decision of how much unsafe water to consume, and we feel like this requires tailored interventions to reduce consumption. Information, as other studies have shown, may reverse the association between safe source consumption and distance, but we're finding that the mechanism operates differently than one might expect, that this only seems to be true from this associative study, that this is when primary water collectors have some free time to walk further. And we feel that future studies should seek to test for the relationships highlighted here about distance, but also to consider the role of spatial and neighborhood effects in driving safe source adoption, which is what the pictures on the right show, where we've already begun to look at neighborhood effects and these other spatial factors in driving adoption. So we would be welcoming your feedback and thoughts about this study, the models, and the way we have framed the problem here. And we want to give a special thanks to our respondents for this project, the women of Chagda, West Bengal, for their incredible participation. And we'd open the floor to you all.
Wonderful. Thank you, Gokul. I wonder, do we have many statisticians in the audience who can have a little input into this? Gokul, I was fascinated by the title, first of all. Let me just throw a couple of questions in your direction while we're awaiting. The whole use of distance, and for me, and forgive me if I missed it, the focus is on sort of meters or simple metrics. Have you considered, carrying capacity or using calories, the actual risk and the energetic expenditure in order to get from safe water to final destination, all of those things? I'm sure you have, but expanding on that, because when you're narrowing in on that statistical model and you're trying to account for all of those factors, and or if somebody else is collecting your water for you, or if you pay for it, I just wonder how you've accounted for all of those.
Right. Well, the friction of distance idea was actually motivated from kind of the field of transportation geography, where it's commonly a parameter that's understood and estimated in models. It represents the sort of burden and time and effort required to overcome distance barriers. And of course, that's way more salient when you're carrying your own water yourself. Calories would be a great way to look at it. It is something that we considered, but we had a really hard time measuring that. And even distance has been really difficult to measure for previous studies. If you look at the literature, you'll find that almost everyone measured distance by just asking households, do you live 0, 5, 10, or 15 minutes away from the safe source, which has a strong bias around whole number intervals. And so, I mean, it was already tough enough for us to measure distance for this small sample size, what we think reveals some rich results. I would be very, very happy to participate in any study that would look deeper at calories and the difficulty and burden of carrying water. But right now, I don't have a way of measuring it.
Yeah, well understood. Yeah, that would be exciting to do. Let me hand the floor over. Emily, please go ahead and ask your question.
Yeah, hi, Gokul. Thanks very much. Like, really interesting presentation. I have no experience in West Bengal, but I have some experience in Liberia. So I just had some thoughts. I don't know how you would incorporate this in your model, but first of all, I think the cooking and drinking water separation is really interesting because my observation in Liberia, where there's a high water table, so there's a lot of wells and pumps, is people would even like they would have one pump for water drinking. Sometimes they'd go to another one that was less safe for cooking, and even like a third really dirty one for bathing. It was like they had so many sort of what they considered safe depending on the use. I know for the really safe drinking water ones, one challenge in Liberia was I was in an urban area, so they'd often keep the really safe pumps heavily guarded and locked, which makes sense because you don't want people contaminating it. But then I feel like people would just be like, oh, it's locked, so I just have to go somewhere else to get my drinking water today. So sort of like not really a model issue, sort of like big picture, like these were some of that was one thing I noticed. I also know a lot of times it was like kids carrying the water, and I don't know, they just didn't want to go far. And they're also sometimes, and I remember one of the wells would get really kind of murky during the dry season, but then during the rainy season, it would, because it was raining a lot, people were like, oh, it's safer now because it's less murky. So anyway, I think it's really interesting because people were so careful to like separate out where they got their water from. So I think your studies are really interesting.
That's exactly how we thought about this problem. Like the way we separated out the problem space and the factors that are affecting the decisions about adoption. They're full of trade-offs, like you mentioned. We're just beginning to scratch the surface. We have so much data about this very small sample. We think that issues of caste, issues of community pressures may be channeling people from some water sources to the other. We think that this possibly interacts with both distance and things like free time. Whether the primary water collector is a child was something that we considered. We did not find significant effects there, but we did find them for women over 50. So, we're just beginning to tease apart this mechanism. A lot of studies have just said, let's do an RCT, information works, but we're really interested in how information changes public health behavior. And so the problem space that you just brought up in Liberia is totally relevant.
Thanks very much. Yeah, really interesting study.
I love that. Yeah, the seasonal impacts, the effects on location and time people have available as well, I think is fascinating. Google, what thoughts do you have for expanding or continuing this study? Where are you looking next?
So a couple of different things. We're really interested in spatial effects, whether neighbors tend to adopt the same water sources as each other, and then whether friends and social networks play a role in water source choice, and then comparing physical distance and network distance. We're thinking, because we have developed these, what we think are pretty solid ways of measuring water consumption, we might return to similar districts in West Bengal and try and run a study like this. We'd do it with a bigger sample, we do it at a bigger scale, but this was one of the first research projects I ever worked on. And so it was kind of small scale. And now that I'm a big bad PhD student, I'm looking to scale up. Yeah.
And looking for that postdoc as well. So yeah, good luck with that.
Yeah.
Any other questions from the audience? I don't see any right now. Google. No, well, okay. Well, thank you so much for that really interesting multivariate study. That's fascinating stuff. I hope you get more money to do more research. I think
that's
that could
be
useful for the so good luck. Donations accepted here. With that, Google, thank you very much. I want to thank all of our presenters and all of our attendees for joining this this verbal session. We've all got a little gap now before posters. I want to remind everybody about the session we have at 3:30, the Careers in WASH for Young Professionals. Really encourage you to join that. Even if you're not a young professional, if you can assist with your guidance in what's happening in the future, would be very useful, especially in the COVID age where so many of our students are having to adapt on the fly. And then for the late early show, much later tonight, I think at 10 p.m. to have a review of today. With that, I'm going to end the session. Thank you, everybody. Have a great day. Catch lunch if you hadn't already. And thank you again. Bye now.
Bye. Thank you.